CPT RVA, page 273, exercise 174, level 2. And the problem reads like this.
Medicine. 1.5 hour of IV chemotherapy by infusion, followed by IV push of a different drug.
Right. This is a medicine section of the CPT code, is the medicine part. And the problem is 1/2 hour of IV chemotherapy by infusion, followed by IV push of a different drug. Okay? So we're going to give you 3 seconds for you to pause the video and then give us the CPT code for this problem. 1, 2, 3. Okay, the answer is 96413 and 96411. Okay? If you got that, you just go to the next video. If you didn't get it, let's give you a couple of tips. Okay, the first tip.
This is a level 2 difficulty?
Right, it is a little complicated, that's why it's level 2, and the reason is that
you need 2 codes.
You need 2 codes.
The order is a bit difficult as well.
Okay, so that's the first tip. The second tip is?
In tabular, 96411 is an additional code, so that should go second.
Right, when you're finding the first code, there's a parenthesis there that says that you have to use an additional code. That's why you need a second code. Okay, with these 2 tips, try to get the path now to the answer. The answer, you know, that is 96413 and 96411. You have to find the path now, how you got to the answer, okay? So we're going to count to 3 so you can pause the video and then give us the path. 1, 2, 3. Okay, this is the summary of the whole problem. The problem is the medicine section, and the problem is 1/2 hour of IV chemotherapy by infusion, followed by IV push of a different drug. Okay, now there are 2 codes. The code 1, can you follow me? The code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to chemotherapy.
You start with chemotherapy.
Then you go to intravenous.
You go to intravenous, and there's a range of codes there, right? They give you 46409 to 15, and then they give you an additional code there. So you have to check all those codes, or you gotta go reading until you get to the right one, okay? So we're gonna do that in the tabular. So the code 1 through the tabular is found like this.
First you go to tabular.
Right?
Then you go to 96409.
Which is the first code of the range that they're giving you. Now we're just reading the definition of that. What is that?
Chemotherapy, intravenous push technique.
Okay, you keep reading.
And then you go to 96411, each additional substance.
Okay, so you have to use the 96411 in conjunction with the right code. And now if you keep reading, you get to the code that we need in 96413, right?
Yes.
Why is that?
Infusion, but it's up to 1 hour. Single, substance, and drug.
Right. In the definition, you find that the 413 is for an infusion, and it's up to 1 hour, and it's a single substance drug. So this is the code that you want, right? So that's why we have the equal sign, which means that this is the code. But remember that in the parentheses, they told you that you have to use an extra code, 96411. So let's go to the tabular. That would be code 2, right?
Yes, code 2.
Code 2. The code 2 through the tabular is checked like this. You go to the tabular, right?
You go tabular, yes. Then you go to 96411.
Which is?
Each additional substance.
And the equal sign means that that's that second code. You just check it, okay? So the answer is 96413 and 96411, okay? Thanks for watching, and please visit our website. Thanks.